I feel very blessed to be here, to be where I am, by either blessings or by luck that I'm here.
In the land of the rising dragon, lives will be transformed. Patients and volunteers alike. They come from the United States, Canada, and as far away as Scotland on a medical mission with Project Vietnam.
115 people. We had 33 physicians, 28 nurses. We had engineers.
Many have been here before. Others are first-timers. And then there are those who were born in Vietnam and left because they had to. One of those people is Dr. Peter Newen from Huntington Beach, California. He's one of 3 plastic surgeons on the Project Vietnam surgical team. The trip brings back difficult memories.
I remember pretty vividly how it was when we left the airport 40 years ago. It was a very fearful time because the country was at war. We left Hue and we went south, we took bus, we took boat. We were even stopped by the Viet Cong on the road, and they chose to let us go.
It was April 1975. The Viet Cong were advancing on Saigon. People were scrambling to leave. Among them, Peter, his parents, and 10 siblings. At the airport, they miraculously ran into an American, a former tenant of theirs, who sponsored the Newen family and helped them to escape on a C-130 aircraft.
I still remember sitting on the tarmac waiting for the American troops. I felt extremely blessed that we were able to leave Vietnam only 2 days before the fall of Saigon.
40 years later, the one-time refugee, now renowned plastic surgeon, prepares for a bittersweet homecoming. Back to the same airport from which he fled as a child.
The country is reunited now, but the fear that the South Vietnamese have of the North Vietnamese is real and it's visceral.
But the need to return is much stronger. After a 19-hour flight, he lands in Ho Chi Minh City. Peter Newen is finally back home. For Dr. Quinn Q, a pediatrician from Orange County and founder of Project Vietnam, it is the 40th time in 20 years that she's brought medical teams to the country. Like Dr. Newen, Dr. Q and her husband, Dr. Chan Q, who's an anesthesiologist, also fled to the United States during the war.
I had sworn to myself that whenever the opportunity, I will go back and do it.
Since 1996, the trips have been their life's mission. Managing the sheer logistics, personnel, communications, supplies is a Herculean task.
So we're now going around, and the team, after it arrives, is sorting all the supplies that they brought in. Here are boxes where you see it's marked surgery, surgery, surgery. All these are surgery supplies that we will be using tomorrow. And in this corner, we have formula. We have a lot of toys.
It's daybreak. The team is jet-lagged but eager to start. Dr. Newen, the nurses, doctors, and surgical team, including Doctors Alex Kim and Jed Horowitz, arrive at Military Hospital 175. Already, a long line of patients is waiting.
This is the first time that this military hospital is opening its doors to American doctors.
It's a great opportunity. I mean, the government now is getting behind what we have been doing.
These are still my people or our people, and I have a certain amount of emotional attachment.
The waiting room quickly fills with hopeful patients who've traveled from the coast and mountains for a one-time shot at a free, life-changing operation for their children.
This is the culmination of a lot of planning. Tell me what this day personally means to you.
I have 3 kids of my own, and seeing those kids with the ability to eat Can't do enough for them.
One after another, the doctors meet their tiny patients. Some need cleft lip surgery. Others need surgery to close the gaping hole in their palates.
People in the Western society looking at these kind of defects, and all they think of is the cosmetic defect. But the problem is that this has a very significant function. If we don't repair this appropriately, it's very difficult to eat. His speech development is going to be abnormal.
As word spreads that American doctors are here to do cleft palate surgeries, more families arrive. Among them, 18-month-old V. Her mother has no appointment, but a friend urged her to come. She's desperate for help and tells us when she takes V out, people point and stare.
Normally in the United States, we would repair this already before the teeth develop.
But V's father is a fisherman from a village 4 hours away. The family barely scrapes by. V's mother, who was also born with a cleft lip, fears that without surgery, V will be unable to find a good job or one day even marry.
For her family, they also have the stigma of having this deformed child. And having very reduced circumstances, there's no way they can have access to the services which can make a difference for them.
1, 2, 3, 4, 2, 4, 6, 7 hours.
Even though the surgeons will have 75 children to operate on over the next 4 days, V is squeezed in. No child is turned away. As the surgeons prep, anxious parents wait to be called.
This is the pre-op room, so basically they come in from the waiting room. We have a set schedule for the kids that are coming in.
This is the turning point for V and her mother.
Do you want your Bovie set up?
V is Dr. Newen's first patient. A few feet away, Dr. Horowitz works on a little boy. And in the next room, Dr. Kim and his team are busy at work. There's no time to waste. The waiting room is full and the clock is ticking as nervous mothers stare at the hospital doors. One after another, the children are rotated from the waiting room to surgery, recovery, and finally return to the arms of their mothers.
This is amazing. The surgeon here is amazing.
You and your wife put together all these people to come and do this. How does that feel to you?
Well, this is not easy. We have to deal with many difficulties, but we always come back because it's really rewarding.
And it's non-stop from 7 a.m. to 7 p.m. The teams work in unison, which is admirable considering many had just met hours earlier.
What was driving you to do that, to work at such a frenetic pace? 7 kids a day.
The reality is that we're there for a very short amount of time. Every hour or two, I feel that I have an opportunity to change a child's life. So I feel a certain sense of urgency.
2 hours after V went into surgery, she's ready to be reunited with her mother. The emotion in the room is palpable.
So she looks beautiful to her.
Yes.
Beautiful, she says, because her daughter's future just became much brighter. It's the morning after surgery. This is where the mothers and children spent the night. The room is packed. Everyone is waiting for the doctors to discharge them. Dr. Newen finds V.
I'm really happy that she's able to have this surgery. I feel great love for these children. As you go through life, you do accumulate a certain amount of wounds in your heart and your soul. And I think that by doing these kind of things, I think that we do heal some of the injury that life deals to you. It's a fair exchange. We help them and they help us.
Long after the teams had gone home, we wondered, did V's life change? We went to her fishing village a few months after surgery. The little girl who was once ridiculed wherever she went looked like any other happy child. And that is the mission of Project Vietnam.